Good day, viewers. Today we're talking about a spastic bladder or a spastic anus. This happens due to several conditions, and it's happened in one of my chronic pain suffering patients where she went in for surgery to remove her piles, and as she was bleeding, and it was an emergency surgery that needed to be done, and after the surgery her bladder went into spasm and she couldn't urinate, and her buttock refused to release any bowel movement because it also went into a spasm, and she had severe pain. Her stomach bloated up significantly. There is a YouTube video showing the swelling of the abdomen and what we did for it. And what they do recommend on the internet is that if it is left untreated, and usually they talk about medication that you take, but there is a lot that physios can do for your spastic bladder and bowel. So what causes is that you've actually got on your stomach, there's specific muscles on the stomach that actually causes irritation of the bladder, which can then prevent it from actually urinating. So it either causes increased frequency of urination with little bits of urine that coming out, or it actually just stops the urinating, and also it causes a retention in the bladder, and you get quite a lot of significant pain on the abdomen. And with her abdomen, it's swelled up 3 times its normal size. She was very gassy, but she couldn't pass any gas, and she couldn't defecate at all. So I used needles on the stomach, on the abdomen, and then I did a deep massage in a clockwise direction, but starting at the bottom and then going to the left, up at the top, and then the right side of the body going round and round and round. And it's a deep pressure that is applied, and as you hold the pressure, you actually feel the stomach gurgling and making noises under your hands, and you hold that pressure until that gas moves, and it actually causes the patient to fart while you're busy working with them. So it's it's something that you need to happen. And then I would just turn her onto her side, and we would apply needles into her sacral region and her lower back, because that's where the nerve that supply the bladder and the bowel come from. That's your sacral region. So we needle those to reduce any spasms of the back in the area, so that the buttock can relax and allow the feces to move through. So you can also use heat on the stomach. You can use a TENS machine with a probe that you insert in the vagina that helps to reduce the spasms by applying a current through it. And then this all helps to reduce the muscle spasm, reduce the pain, increase the frequency of passing gas, and therefore normalizing the passing of the urine so that the stomach and the back doesn't cramp anymore. I hope you find this beneficial, and you can see some of the other links of actually myself busy massaging the patient as well as applying the needles that we have showed you short little videos. I'll try not to keep it too long.